Now I'm going to use Noelle again to demonstrate how to administer an IM or intramuscular injection into the vastus lateralis. The vastus lateralis is a large muscle that is on the anterior lateral aspect of each thigh. And to landmark for this site, basically the best way to look at it is the middle third portion of the outer aspect of the thigh is where you want to administer. But to landmark, you can put one hand at the client's groin, one hand at the client's knee, and anywhere, preferably the central portion of that is where you would want to inject. So right in the center portion, and Noelle actually has a pad for us to see. This muscle is actually fairly well developed, even in neonates, brand new babies, because when they're in utero they're kicking, but certainly in adults as well. It can be difficult if we have neonates who have been delivered and are a few months of age and or frail adults. They won't have this if they're not walking. They won't have this muscle as well developed. So it's important that when we actually inject for them that we actually grab the muscle. Okay, so in frail elderly or children who are not walking. So in terms of this, basically we have landmarked and we want this center of this interior aspect of the thigh. So I've wiped that with my alcohol swab. And your client can be sitting or they can be lying down as Noelle is and with their legs straight out. Typically our needle is 1.5 inches in length, but for smaller, frail elderly or children, we would use a 1-inch needle. I'm going to pull back taut to do my Z tracking, and I'm going straight in, aspirate, watch for blood return, and then slowly inject. 1, 2, 3, 4, 5 seconds for 5 mils. Great. Then we dispose of our needle in our sharps container, and we make sure to document the site, location, amount of liquid, and medication that we've administered on the MAR. Great. Thanks, Noelle.